Today's topic is male urinary leakage. I'm Geri White from Hudson Valley Physical Therapy, and this is
Zazu, Cioce. I'm a pelvic health and orthopedic physical therapist here at Hudson Valley with Geri. And yeah, today we are going to talk about male urinary leakage, which is also called urinary incontinence. And so June is Men's Health Month. So this is our kind of second installment. Last week we talked about male pelvic pain. This week we're going to talk about male urinary incontinence or male urinary leakage and what are some common myths that we can bust. So just as a reminder, the information provided is not meant to be a substitute for medical evaluation or treatment. This content is meant for educational purposes only, and if you do have any issues that you would like to talk with one of us about, we do have 15-minute free consults over the phone that we would be really happy to be able to chat with you about what's going on and maybe point you in the right direction.
Right. Great. Okay. All right. So the first myth, which we actually busted last week and we'll bust again this week because it's such an important thing that people should know. Males don't have pelvic floors, and that is 100% incorrect. And I think the reason being is you see a lot more subjects or a lot more things out on social media regarding the female pelvic floor, but men do have male pelvic floors as well. So as you see in these illustrations here on the top left, is your male pelvic floor muscles in general. There are 3 layers, and what we see here is just 2 of the layers in these illustrations. So the muscles go from front to back or back to front, however you want to see it. But in terms of the top left illustration, you've got the tailbone in the back there, and then it goes up towards the front, towards your pubic bone. And the muscles, again, they go from front to back, back to front, and out to the sides. They surround the opening, so meaning the anal opening, and then around the urinary or urethral sphincter to help with bladder control. And then at the top left, or I'm sorry, top right illustration is a side view of the male pelvis, and the front is that pubic bone there. And if you go towards the back, you see the tailbone, and then going up towards the sacrum and then lumbar spine. The pelvic floor muscles, again, are the bottom part of the pelvis, supporting the structures above, so from front to back. And then in the pelvic cavity, you see behind the pelvic bone is your bladder, and then behind the bladder is your rectum, going down to the anal opening. And below your bladder is your prostate gland, which is there, you see there. And then out below your bladder is the urethra. Going out is where you urinate. Thank you. And then the bottom photo or illustration is your deep layer of pelvic floor muscles, looking at yourself from the top down. So again, front to back, the front is your pubic bone, and then the back is your tailbone. And everything in between, and those rose-colored, kind of pinky-colored structures are your pelvic floor muscles. These are your deep layers of your pelvic floor muscles, again, forming a nice supportive structure on the base at the bottom of your pelvis. And functions of the pelvic floor muscles are sphincteric, meaning they help to close and control the sphincters. So your urethral sphincter, your anal sphincter. So for bladder and bowel control, and also helps with sexual functioning. The other functions of the pelvic floor muscles are supportive in nature, as you can see in these illustrations, supports the structure above it. And then the other function is shock absorber. So you need a little bit of tone, almost like a trampoline, to help support again, the abdominal organs above. And did I miss anything else? I think that's it, right? So, yep. So that is your male pelvic floor muscles. 3 layers, same as females, front to back. There you go.
Definitely. Yeah, that was great. So, right, the next myth is males don't leak urine. Well, that is a myth. If you have the ability to pee, then you have the ability to leak. So whether you're, male or female, or, whatever you identify as, you have the ability to leak if you are have a urinary system. So that is one myth. And again, I think it alludes to what Geri was talking about, how there's just a lot more out there at this point for females as in terms of education than there is for males. And also males tend to not really talk about like what's going on with them. Certainly like some females do too, but with females, because of the whole like pregnancy, postpartum thing, where, you know, a lot of times like people will leak after having babies, those types of things, then it's talked about a little bit more, and it's a little bit easier to ask, you know, like your mom or your sister or your girlfriend, like, hey, is this happening to you? But for males, I find that it is just something that is kind of kept in, and it's something that necessarily like they don't really ask any of their friends or anybody in their network about unless it becomes like a real problem. So which we would say that if you're leaking at all, that's a problem, but you know, that's certainly, you know, each individual's right to decide if that is or not. So yeah, so that is a myth. Males can leak urine. And just to talk a little bit about the types of urinary incontinence, so this goes, you know, for males and females, you know, across the board, or anybody with a urinary system across the board. So you have a few different types. I'm just going to touch on the main types, which one is called stress urinary incontinence. The other is called urge urinary incontinence. And so stress urinary incontinence is where there's a pressure issue. So you have either the pressure within the bladder or in the abdominal cavity is greater than the pressure provided in response by the pelvic floor or by the prostate in the specific situation for males. So that can happen when, I don't know, when you laugh, when you cough, when you sneeze. Those are situations where if the pelvic floor pressure and just pelvic floor function in general is not working up to par, then it could provide the opportunity to leak urine. And again, the prostate itself, because it is wrapped around the urethra, does also provide a closing pressure to try to help stop leakage of urine. So that is one type. Another thing that can kind of bring on stress urinary incontinence, if that's an issue for you, is like jumping, types of impact maneuvers, running, those types of things. And so the other type is urinary incontinence, urge. So it basically is what its name is if when you have the urge, that's when you leak. So you don't necessarily need to like laugh, sneeze, cough, or jump, or run, or have like a pressure issue. It's literally just when you have an urge to urinate and you cannot make it to the bathroom in time before leaking urine. So, you know, a lot of the times we talk about key in the door, you know, urinary leakage. So it's like you are driving home from work or driving home from wherever, you've got a full bladder, you know you're getting close to the toilet, you put your key in the door and the bladder just goes. So, you know, that strong urge and just urge in general is associated with the leakage. And then you have mixed urinary incontinence, which is a mixture of both the stress urinary incontinence and the urge urinary incontinence. So you've got a little bit of both going on. And so those are the main types that we generally see here in outpatient clinics.
Right.
So yeah, males can leak, and they can leak in a variety of ways.
Exactly. Right. So, all right, the third myth, leakage after prostate surgery is something you have to live with. No, not necessarily. Although, you know, our patients who come in with prostatectomies or prostate surgeries or radiation treatments to the prostate of some kind do have leakage. And what the doctors have told them is that they should expect to be leaking, which is a normal thing, up to a year post-operatively. So, but for us, seeing the males or patients come in prostate surgery, the earlier the better to actually address the leakage issue with the pelvic floor. And Zazu will go into that with myth number 4. But so prostate, so as you can see in the on the top right hand of the illustration there, the prostate, where it is, as I said before, is just underneath the bladder. And what goes through the prostate is your urethra, and then also a lot of the nerves that go down to control the sphincter and also the pelvic floor muscles. So if you've had surgery to remove the prostate, as well as radiation treatment, it might damage those nerve endings, which then might influence your ability to control your urine. That's why they're saying up to a year, because sometimes the healing for that area will take up to a year. And then hopefully you will get your leakage or under control, or if not gone 100%. But what's important is to really get the Kegels and pelvic floor muscles activate as soon as you can. And even actually I've seen 1 or 2 patients coming in preoperatively for a prehab component so that they learn how to Kegel correctly, so that when they come back after their surgery, once they're okay or cleared by the surgeon to start with pelvic floor exercises, then they actually have a running start in a way, so that we can really get them going on a pretty progressive pelvic rehab program. So yes, so leakage after surgery, you should not have to deal with. Is definitely controllable. Okay.
Yeah, awesome. So yeah, and so then the last one that we have for today is Kegels are easy to do. So for some people, they may very well be easy. But what I would say for the majority of people and for a lot of the men that I see here, they are a little difficult to get the hang of. And I think with men, this is just, you know, a story is that they're not as connected to their pelvic floors as women may be. And certainly there are both men and women who are, you know, outside of that category and maybe very well or not, either way. But it's just something that I tend to see. And so really gaining consciousness and awareness of what's going on down there is really important to be able to know whether you are doing a Kegel correctly or not. And so research has shown that a lot of people that are just verbally told how to do a Kegel, or just given like a brochure, even if you watch like a YouTube video, it's not 100% that you're going to be able to do them correctly. And in fact, a lot of people don't do them correctly. And so it's like, you're doing this and you're wondering why it's not working. Well, maybe you're not doing it correctly. Or maybe the Kegel is not something that you need. So for a variety of reasons, you know, it's important to know why you're Kegeling and if you need to Kegel. So in this case, right, just some tips if you are one of those people that like Kegels is something that was prescribed to you, or you feel like you want to try, whatever, you can kind of figure out if you're doing them correctly or not outside of the clinic, outside of coming in to seeing one of us. Is so a few different ways. So first way is you can use a mirror. So if you take a mirror and you basically lie down and you put the mirror just on right the other side of the genitals, or in this area where you see in this picture here, where you can visualize that area, right? Like no underwear on, you can see skin, all that good stuff. Then when you do a Kegel, it should feel like, you know, you are closing the anus, like as if you're trying to hold back gas. And so if you're doing that correctly, then the anus is going to kind of close. And then you're also going to see the tissue in this area where I have here with the pointer also kind of coming up and in, almost like tightening. And those are your pelvic floor muscles working. As a male, you'll also see kind of like from the base of the penis that the penis will move as well. So that's one way, is to use a mirror. Another way is to use, you know, the pads of your fingers and either put them in the area between like the base of the shaft and or the like testicular sac and the anal opening, in this space in between here, which we call your perineum. and just put to the pads of your fingers there. And then again, try to hold back gas, like you're in a crowded elevator and you don't want to pass gas. And then you should feel, again, like those muscles are firming up underneath your fingers, and it's almost like they're kind of lifting. And again, the anus is closing or squeezing. And another way you can use your finger is to literally, with some lubrication or water, whatever, place like one finger just internally, maybe to your first knuckle or so, and you should feel when you squeeze to try to, stop gas or stop the flow of urine, that you should feel the anus actually squeeze around your finger to close. So another thing you can do is you can take a towel and roll it up like a hot dog and put it to where it's basically like in contact with all of these muscles. So if you have like a thin layer of pant on or just like your underwear on, that's fine. But anything thicker like jeans or thicker pants, like it's not going to work because you need to actually feel the towel on these tissues. So you're going to, run the towel from the pubic bone back towards the tailbone, and you're going to try to do your Kegel. When you do your Kegel, you should feel like, again, that the tissue in this area is kind of like lifting off of the towel. And if you're not feeling anything happening, or if you're feeling like a pushing down into the towel, then it's very likely that you are not doing the Kegel correctly. And so you need to reassess how you're doing it, try something different until you can kind of get that sensation of, okay, yeah, it feels like I'm kind of lifting up off of the towel versus pushing down into the towel, or just nothing happening. If nothing's happening, then it probably just means that, again, you need to work a little bit more on the connection between your brain and the awareness of the pelvic floor, and then hopefully you can improve upon your contraction of those pelvic floor muscles via the Kegel. Any other tips or cues that you use, Geri?
No, I use all those, and the key one is also the breath, right? So just making sure that you're not holding your breath as you're Kegeling, and because a lot of people think they should hold their breath, and actually you're just seeing a lot of like upper chest movement versus the pure activation or isolated activation of the pelvic muscles. So just making sure you're breathing out while you're Kegeling.
Yeah, no, that's definitely great. The breathing is important. And then that also reminds me of, right, this is for specifically like an isolated pelvic floor contraction. An isolated pelvic floor contraction means you're only trying to contract these muscles here. An integrated pelvic floor contraction is where you're trying to also contract, these are your glutes. Maybe like your inner thigh muscles that are coming in through here. Maybe getting a little bit more abs in. And so those all need to work together. All of those muscle groups need to work together, but you need to make sure, just like you can squeeze your butt cheeks on your own without, having to activate all these other muscles to do it, you should also be able to do that with your pelvic floor. So first, again, if it's difficult for you to try to just get those small muscles, that's what you need to work on. And then you can work on integrating all of the larger muscle groups, maybe like during a squat or during like a bending down to pick something up, and activating everything together. But certainly you need to be able to do it isolated, just the pelvic floor, and everything together as well.
Right. Exactly. Good. Okay, yeah, so that's basically the myths that we wanted to bust today. If you have any specific questions regarding your own specific case, feel free to reach out to us. Our emails are right there, and we do offer free 15-minute consults. And again, to answer any specific questions you have, and to see maybe pelvic floor PT consult in terms of an in-office visit might be helpful for you, depending on where you're at with your healing. So we're here.
Definitely. Definitely. And I'd also say telehealth.
Exactly. Telehealth is, yep. So we have that offer as well. Okay. So that's it for today. And next week we will see you back for Myth Busting Monday. Bye, everyone.
Bye, everybody.